should require it is behind you. It's just that door there.
Okie dokie.
So if anybody needs to get out quick.
Okay. All right, good afternoon everybody. Thanks a lot for coming along. My talk today is on equine osteopathy, a little bit of confirmation and horse and rider video analysis. So let me tell you what this afternoon is going to consist of. We're going to start with a little bit about me, my horsey background. We're then going to talk about osteopathy and equine osteopathy, then go into some of the similarities and differences between horses and humans, some confirmation issues, then more depth into more depth into what an equine osteopathic consultation consists of, and then lastly, the horse and rider video analysis. So, some of you might know me. There's certainly a couple of faces that I recognise, but let me tell you a bit about me. So, my name's David Powers. I'm a human osteopath. I graduated in 1996 from a place called the British School of Osteopathy. So, my plan was always that I wanted to treat horses, but you have to do people first. So, I graduated in 96. I worked in human practice for a few years, 4 to 5 days a week, and started practicing on my own horse on the weekends. Then in about 2000 I did a postgraduate diploma in equine osteopathy and started working on horses probably 1 day a week. As time went on, I increased that, and then the last 10 years I've actually cut back my human work to just 1 day a week, and I now do horses 3 to 4 days a week. Hopefully over the next couple of years I'll give up people completely and just treat horses. So my horsey background is I've actually ridden since I was 4, and I only stopped about 3 years ago when we retired my mare. As a teenager I was really into show jumping, and I worked for a dealer, a guy called Roddy Dean, who jumped around the Hickstead Derby a couple of times, and then I worked for the late international rider Tim Stockdale. As I got older and probably a little bit less brave, my interest went away from show jumping and more into dressage. And then when I got into my 20s and career took over, and then my 30s and family took over, horses really, well, the riding side actually took a bit of a back seat. Can you click forward, please? Okay, so this is my mare. Her name's Pepsi. She's now 36. I've had her since she was 3, so I was 13. I'm now 46. These are my kids. My horse quite likes selfies, but I don't think she likes my kids very much. Anyway, so after graduating as a human osteo, I worked as an associate in a number of practices around London and Essex before eventually buying my own. And then, as I mentioned previously, eventually cutting back my human practice and working more on horses. So, what exactly is osteopathy? So, osteopathy is a method of assessing, treating and preventing a wide range of health problems. Osteopathy is a combination of movement, stretching, targeted tissue massage and manipulation of the muscles and joints to improve function, relieve pain and aid recovery. Equine osteopathy is based on the principle that the horse's body can heal, and equine osteopathic care focuses on strengthening the musculoskeletal system to treat existing conditions and to prevent illness. An equine osteopath's approach to health and well-being means they consider symptoms in the context of the animal's full medical history, i.e. it's holistic. So osteopathy is a whole body system of manual therapy based on biomechanical principles which use a wide range of techniques to treat musculoskeletal problems and other functional disorders of the horse's body. Human osteopathy was developed in America in the 1870s by a doctor called Dr. Andrew Taylor Still, and it's now developed to the point where it's widely recognised throughout the world as one of the most effective complementary therapies. Equine osteopathy is a more recent phenomenon, with equine osteopaths extending many of the techniques applicable to human osteopathy to horses. So what are some of the common things that I actually see? Well, back pain and sacroiliac lesions are definitely the most common. That's the same in my human practice. So I essentially deal with this part of the low back this part of the pelvis. And it's the same in horses. I reckon 80% of my work is spent dealing with issues there. But I also deal with cold back, stiffness. I help with rehabilitation after injury, head tossing, reduced level of performance. Now, I imagine that some of you get on your horses some days and you just think, oh, he doesn't feel right, he won't do this, he won't do that. You know, he may well have some pain or discomfort somewhere. As well as that, I help with changes of behaviour, such as bucking, rearing, refusing to jump, kicking, reluctance to trot or canter on certain reins, diagnose conditions such as degenerative arthritis and lameness. And obviously, I'm only dealing with the mechanical side of things and essentially the compensation from the lameness, not the lameness itself. In many cases, an animal has learned to compensate for pain or musculoskeletal discomfort over time, for example, from an old injury in the leg. This then manifests itself somewhere else, such as in the spine. So, what about anatomy? Are there similarities and differences between horses and humans? Yep, there's quite a lot. So if you look at this one, and then the next one, please, Anne.
And the next one?
That's fine.
Next.
So comparison of humans to horses logically starts with the anatomy. We stand upright, horses stand prone on their forelimbs. What we call our of horses, and our heels or ankles are horses' hocks. Our foot is their cannon bone, and from the fetlock to the ground are our fingers and toes. Our fingernail is their hoof, and our nail growth generates from the cuticle, their hoof from the coronary band. The hoof is the weight-bearing structure so susceptible to laminitis. Humans don't get laminitis, but a diabetic's loss of blood supply to the lower limb has some comparable pathology. The forelimb is complex in the horse, with the head and neck being a crane-like structure that causes 60% of a horse's body weight distribution to the forelimbs. Therefore, impact is greatest on the front legs. So if you think about what you ask your horse to do when you get on board, if this is your horse's back and you've got 60% of its weight in front, it's immediately a bit downhill. It's immediately on its forehand. You add your weight on top and you're working hard to pull it up. So you've always got to be thinking of the engine being the back. What we really call the horse's knee is our wrist. From our wrist to the first knuckle is their single cannon, with the splints along the side being remnants of other palm bones. Again, each finger is analogous to the horse's single fetlock and hoof. Our hands and feet are well endowed with muscles. On the contrary, the forelimbs and hind limbs of the horse are essentially devoid of muscle below their so-called knees, with the tendons and ligaments being a spring-loading system of recoil that adds to the efficiency of movement. Horses don't have clavicles, so the front limbs are held to the body by soft tissue alone, i.e. muscles, tendons and fibrous sheets of fascia. So what are some of the common musculoskeletal problems that that I see every day? Spavins, splints, we'll go into a bit more depth on them later. Arthritis, again, I'll talk about that later. Sprained flexor tendons, sprained sensory ligaments, capped hock and elbow, thorapin, Wingles, navicular laminitis. All of these can present as musculoskeletal symptoms. So can any of you talk horse? I don't know if you know what I mean by that. Some of you might have grown up with horses and you find that being in the horse world, there's almost like a different language that horse people speak. Let's go through some of the terms. So we'll start with something simple. Action. This is the movement of the horse's legs. Back at the knee. This is a conformation fault in which the foreleg is bowed back at the knee. It's more serious than over at the knee because it places additional strain on the tendons running down the back of the lower leg and more concussive forces to the front of the knee. Bone. Do you know what bone means? Well, bone is the ratio of bone to the horse's weight. It's measured just below the knee or hock, and it determines the horse's ability to carry weight. Buck-kneed. conformation fault in which the foreleg bows forward at the knee. It's also called over at the knee. Cross-firing. This is quite an interesting one. A condition in which the hind foot strikes the opposite front leg or hoof. Degenerative joint disease. So this is a term for a group of disorders resulting in progressive deterioration of the articular cartilage of a joint, accompanied by bone proliferation around the joint margins and thickening of the soft tissues of the joint. So to explain that simply, your typical joint is made up of bone and bone. On the end of those bones, so here and here, should be cartilage, which ideally would be nice and smooth, so that when the two surfaces bend, they move over each other quite freely. But as you age, as your horse age, as wear and tear goes through the joint, those smooth surfaces become a little bit roughened, a bit like my knuckles. Okay, so this is degeneration. You then get bone proliferation, which is new bone growth. So if you look at some elderly relatives, you might see, particularly in their knees, that their knees are actually quite enlarged. And that's what happens with degeneration. Dipped back. This is an unusually hollow back between the withers and the croup. Often seen with age, lack of work. Dishing. This is a faulty action where the foot of the foreleg is thrown outward in a circular movement with each stride. Flat-footed, when the angle of the foot is noticeably less than 45 degrees. Forging. It's a fault in the gait which occurs when a hind foot strikes the bottom of the front foot. Hocks well let down is a term used to indicate a horse that's short cannon bones. It's considered to be a good conformational trait. Interference is a faulty gait in which a foot strikes the fetlock or cannon of the opposite foot. Knock-kneed, I think, can probably work that out. Nerve blocks. A diagnostic tool in which the vet progressively blocks the nerves of the hoof and leg in order to determine the location of lameness. Paddling. Throwing the front feet outward as they are picked up. Most common in toe-narrow or pigeon-toed horses. Sickle hocks. Hocks which are bent, giving the hind leg the shape of a sickle, with the hind legs too far under the body. Splints. So I mentioned these before. This is injury to one or both of the metacarpal or splint bones that lay on either side of the cannon. Stress or strain can cause the ligaments attaching these bones to the cannon to pull and tear, causing heat, swelling and lameness. I reckon that I see inactive splints in probably every other, if not 1 in 3 horses. Tied in below the knee. This is a conformation fault in which the circumference of the cannon bone is substantially less than that above the fetlock. Unsoundness is a term used to describe any condition or conformation fault that limits the horse's ability to perform his job. It may include conditions of the muscles, bones, heart, lungs or other organs. Okay, so let's get a little bit away from that. Let's get back on some osteopathy. And I'll give you an overview of what occurs during a consultation. So during a consultation, the animal is checked from the hooves upwards and from the nose to the tail. So it's all encompassing. A typical appointment runs like this. A detailed case history is taken in order to find any previous injuries or illnesses that may be responsible for pain or discomfort in the horse. A visual examination is carried out, which involves walking, trotting and circling the horse in hand. A physical examination then takes place involving evaluating the whole animal, including joints and muscles. The important thing before I come out is you must get veterinary confirmation. I can't actually touch your horse without that. So how long does a session last? The initial consultation is about 45 minutes. Follow-ups are about half an hour. If I go into a bit more depth now about what I'm actually looking for and what I ask and probably even why I ask it. So I start with some basic questioning. So how long has the horse been owned? What level of work is it doing? What's expected in the short and long term? So if I come out and see a horse that's essentially a happy hacker, and then I see another horse that is a 3-day eventer, you're going to want completely different things from it. And there's different things that I can actually give it. One of the questions I ask is, what are the value of your horse? I always find it a bit of a difficult question to ask. The reason I ask it is because my insurance only covers me up to 5 million. I haven't seen anything that expensive. The most expensive was a grade A, about 170,000. So we then move on to the reason I'm there, finding out what's wrong, why I've been called out, how long's the problem been there, when is it noticeable? So is it when you ride, is it when you lunge, is it in the stable, is it when you just get them out of the stable? Have you had anybody else have a look at the problem? Has the saddle been checked? Was the saddle fitted to the horse or around it? Nowadays, people seem to be getting their saddles checked yearly, and okay, that's a good start. But if you think about what you ask of your horse day in, day out, it's different all the time. So an eventer, for example, one day out galloping across the field, the next in the manage doing dressage. So you're using different muscles, different joints. A lot of the event horses I see get their saddles checked every 3 months. Has the farrier checked its feet? Has the horse had any major accidents or illnesses? All of these things might have a bearing on why the horse is presenting with the particular problem. Okay, let's get on to something a little less dry, and assume I've taken a case history and we've moved on to the examination. So I start with the observation, and this occurs as soon as I meet the horse. I want to see how it stands. Does it rest on one leg? What's his demeanour? Does it seem approachable? I may have found out some of this from conversations with the vet or farrier, dentist or saddler beforehand, but I like to make my own mind up. Then generally we get the horse out the stable and walk it to either a manage that's not too deep, so as not to affect its way of going, but ideally flat level ground. So the first part of the examination is known as the active examination and consists of seeing the horse move generally up and down in walk and trot, and do circles in hand as well as rein back. Can you move on? Okay, I think we've got a video now. Okay, if you press it again, it should play. Okay, so this is a horse called Girton and the owner's called Vicky. She's given permission for me to use all of this. Okay, so we've done the walk and trot up, we've done the circles. And we do the rein back. Okay. So I sometimes observe the horse on the lunge and occasionally ridden, but the riding aspect is more commonly performed when I do the horse and rider video analysis, which is what I'm coming on to later. I observe initially from the back as the horse moves away, but I also observe from the front. Do you know what some of the things I'm actually looking for are? I imagine most of you have been there when the vets come out and you've seen the vets watch the horse walk and trot away, but do you know what the vet's looking for? Any idea what they're looking for? No? A lot of blank faces? Yep. Okay.
Imbalances.
Sorry?
Imbalances.
Yep. Okay. Imbalances where?
Well, if it's going away from you, you'd be looking at the hinds.
Yeah.
Well, really from the SI joints
Yeah.
down.
Good. Okay. Yeah. Okay. So, so I mean, I'm generally looking for ear, shoulder, and pelvic symmetry, length of stride, differences in muscle tone, any obvious pain or discomfort, lameness obviously, range and quality of movement. So range of movement is actually how far a joint moves. So if you imagine point A and point B, that's the range of movement. Quality of movement is how well that joint does the movement. So is it quite fluid, or is it quite stiff? That gives me an idea of what's going on inside each joint. Then I have a walk round the horse looking for any abnormalities. And then I move on to the passive examination. So I've got another video here. So this is just an overview. I haven't gone through all of it. Okay, so the initial palpatory examination starts by running my hand over the horse. I normally start at the head, along the neck, up through the shoulder, over the thoracic spine, ribs, lumbar spine, pelvis, forelimbs and hind limbs. Again, some of the things I'm looking for are obvious changes in temperature, size, symmetry and pain. So the passive examination, let me talk you through some anatomy. So starting at the forelimbs, we start with the second and third phalanx and the navicular. We then move up to the first and second phalanx, making up the pastern. We then come up to the knee, so or what a horsey people call the knee. So the knee is actually the wrist, and it's made up of 8 bones. Essentially, it's the radius on the carpal with splints either side. On top, you've got the radial carpal, intermediate carpal, ulnar carpal, and accessory carpal. Below, you've got first, second, third, and fourth carpal bones. Now, a similar thing occurs in our wrist. We also have 8 bones, 2 rows of 4 bones. They're called hamate, capitate, trapezoid, trapezium, pisiform, triquetral, lunate, and scaphoid. In us, they're quite small. In a horse, they're probably about this size. From the wrist stroke knee, we move up to the elbow. The elbow is the articulation between the humerus above and the radius stroke ulna below. The point of the elbow, or the olecranon, is formed by the antenatal process of the ulna, inserting into the olecranon fossa of the humerus. Then we move up to the shoulder. The shoulder joint links the humerus and the scapula. Okay, and then we're on to the hinds. So we've got second and third phalanx, first and second phalanx. Up to the hock, which is the tibia and 6 metatarsal bones. We then come up to the stifle, which is actually the true knee. It's the largest joint in the body. It's made up of the tibia and the femur. So femur and tibia with the patella on top. We then come up to the hip, which is the upper end of the femur fitting into the socket of the hip bone. Okay, so then we're on to the spine. And the spine is split into essentially 3 sections: cervical, thoracic and lumbar. The main difference between the equine and the human spine is number of vertebrae. They basically have more than we do. So in the human and equine spine, we both have 7 vertebrae in our neck, and they have almost as much mobility as we do, i.e. they can flex, extend, rotate, side bend. When you move down to the thoracic spine, i.e. this part, we have 12 thoracic vertebrae and 12 pairs of ribs. Horses have got 18. Down to the lumbar spine, we have 5, they have 6. From there you're on to the sacrum and then the coccyx. Their sacrum is made up of 5 fused vertebrae, ours is 3 to 4. Our coccyx, which is about this long, their coccyx, which is about this long. and their coccyx is the tail, and that's made up of 15 to 22 vertebrae. So during the passive examination, what am I looking for? Some of these things I've mentioned before: range and quality of movement, symmetry at the ears, shoulders, length of stride, muscle imbalances. What do I do to change them? Well, the treatment I give as an osteopath to horses is very similar to the treatment I give to people. So it consists of articulation and manipulation to the spinal and peripheral joints in conjunction with soft tissue. As well as that, I tend to give the owners a rehab plan consisting of specific in-hand, ridden and lunge work. So, the other part of my talk is horse and rider video analysis. Now, this is something I've been working on for, well, at least 5 years. I found that I was going out treating horses and getting improvement, but then getting to a point where I seemed to plateau with improving any further. And it actually turned out that it was often the rider causing the problem. So in an ideal world, it's really the rider that you need to work on first rather than the horse. So what is horse and rider video analysis? Well, the way the rider sits on the horse has a dramatic effect on its soundness, performance and development. Rider analysis sessions are designed for riders of all levels to help improve the rider's position and horse's way of going. Using video and digital photography alongside active orthopaedic rider examination, the rider's position and horse's way of going can be assessed. So what does the horse and rider video analysis session consist of? Well, I start with an active examination of the rider, and it's normally performed on the yard. So if you could just press play, please. Okay, drop your head forward, back to normal. Look left, look right, back to normal. Left ear to left shoulder, and to the right, back to normal. Look up at the ceiling, back to normal. Bend forward, touch toes, back to normal. Left hand down the outside of your left leg, back to normal, and to the right, back to normal, and lean back, back to normal. Okay, these are just some examples of some of the sheets that you get sent afterwards. Okay, so as well as taking some video of the rider, I also take photos of the rider from the front, the back, and both sides. And from this, I carry out a thing called postural analysis. So essentially, I draw lines down your back and show where your posture should be, as opposed to where it is. If you can then click, not here. In fact, yeah, no, this is fine. And go. And up. Just goes down as far as you feel comfortable, and up. And down. And up. I've got some examples on the side of what you actually get, which you can look at after. So there I was just assessing hips and shoulders. Okay, can you click forward. Okay, so this is a girl called Sammy who I saw probably, I don't know, a few years ago now. She rides up to about Grand Prix, so she's a pretty decent rider. This particular picture doesn't show it very well. If you could just move on to the next one. If you look, what you can see here, the green line is actually where her posture should be, and the red lines are where they are. It doesn't come out very well on this overhead projector. If you flick onto the next photo. Okay, so this is a bit better. Can any of you see where the main problem is with her posture? The head, yeah. So she's got what's known as an anterior head posture. So if you imagine that there should be a straight line down from the ear to the shoulder to the hip to the heel, yeah, she's probably in about 40 degrees of flexion. When she rides, that weight is coming down through the withers rather than down through her seat. Interestingly, she actually used to ride with her legs quite a long way forward as well. I never quite understood it, how she got as far as she did, but go on to the next picture, please. Yeah, so looking at this from the back, you can see that she's slightly off, but overall not too bad. So there is asymmetry through her shoulders. In person, she actually has a bit of a rotation. Pelvis is okay, knee is okay, and heels are okay. Next, please. Okay, so her left side is probably slightly better, certainly through the neck. Okay, right. So, this was a rider, a guy called Tom. I saw him probably about a year or so ago. When I actually get you to do the video analysis, I get you to wear one of these visualised jackets. So it's already got the lines drawn on the back, so you have an idea of where you're going wrong. But I actually video you riding, and then at points I pause the video and I can draw on the video where you're going wrong. So I don't know if you can see, but you can see the asymmetry in his shoulders. So this right shoulder is high. Top part of his thorax is side shifted to the left, and his pelvis is side shifted to the right. Now he was just going down the long side here in a straight line, so there's no way he should have been like that. Okay, next one. Okay, this is a gentleman called Guy. He rides to quite a decent level at eventing. You can see where I've drawn the lines on here, and certainly his lower leg is far too far forward for what he wants to achieve with this mare. Okay, again, green is where it should be, red is where it is. I think if we move on to the next photo, yeah. So can you see how off he is? Yeah, that's all right. So, the actual rider analysis, what does it consist of? Well, initially you'll warm up for about 10 minutes wearing one of those visualised jackets. The rider is then videoed and photographed performing a series of circles and straight lines in walk, trot and canter. From here, an analysis of the rider's position, way of going and effect on the horse is made. An annotated audio and video file is prepared and emailed over to you within a week. Okay, I think there's another video. Unless we've missed one.
I don't have another one on the next slide either. I can keep going with it.
That's a bit odd. Okay, all right, it shouldn't be this far. All right, okay, well, I think we seem to have lost a video somewhere. Essentially, it was a video showing me going through the process of videoing someone. It's stopping at certain points where I then draw on the video and I'm speaking to the rider. So why would you have something like this done? Well, you get instant feedback while mounted. I'm not a riding instructor. I don't have my BHS exams, but I have ridden for a long time and my specialty is mechanics. So I can see where you should be as a rider. It's something that you'd use ideally as a foundation to build on before calling me out for osteopathic treatment of your horse. It doesn't normally work that way. It seems to work the other way, that I'm called out to treat the horse. I treat it a few times, then I see issues with the rider and we move on to the rider. It's a logical process in evaluating your position and horse's way of going. You get a thorough rehab exercise plan consisting of photos, videos, notes to help improve your position and understanding. You get detailed feedback forms given after the session. It can improve your dressage marks and jumping. Now, I don't know if you're into dressage or jumping, but certainly with dressage, just a couple of marks will certainly get you placed. Jumping-wise, if you're having less of a detrimental effect on your horse's way of going. Your horse goes clear, you get into the jump off. It motivates the rider to work on themselves to improve their horse's way of going and provides clarity on the rider's position and weaknesses. So who is it for? Well, it's actually for all types of riders, happy hackers to international, riding club through to Grand Prix. What do you actually get for your money? So you get the rider analysis, which is an audio over annotated video explanation of where your riding position is impacting your horse's movement or rider position needs correcting. You get a thing called a posture screen, which is essentially a lot of photos of your posture showing where you're going wrong and what you need to do to work to improve it. You also get a movement screen, which is, you saw Vicky doing some movements like this. This is where I show where there are issues in the range of movement in the large joints of your body, i.e. your shoulders and your hips. You get a thing called a lean screen, which is a 3D estimate of the rider's percentage body fat, waist to hip ratio and body mass index. Lastly and importantly, because the other part you might not like, is the rehab exercise plan to fix the problem. So it's a bespoke exercise plan with photos, full instructions, reps, sets, time and video links for further clarification. So, the important thing, what do I charge? Well, the couple of you who use me already know what I charge for equine osteopathy. That's £75. For that, you get a case history, active and passive examination, treatment, a report of findings to the owner and the vet if necessary, a written treatment plan, and a rehab or exercise plan as necessary. What about the horse and rider video analysis? Well, it's normally between £99 and £140 dependent on numbers. But as you've sat and listened to me talk today, I'm going to offer it to you for £65 as long as you book it within the next 7 days. Okay, that's me. Thanks a lot for listening.